Welcome, I'm Dr. Jamie Wells, and this is very exciting that Drexel BIOMED is spearheading the nation's first pediatric engineering program. And we have a distinguished lecturer with us, Dr. Anders Kolb, who is a pediatric hematologist-oncologist extraordinaire. He is the director of the Blood and Cancer Center at Nemours Alfred I. DuPont Children's Hospital, among 1,000,001 other illustrious titles. And he is such a dedicated pediatric oncologist, so we're thrilled that he's here today to speak to our students about childhood cancers. Why were you so excited to come when we sent the invitation your way?
I'm thrilled to be here, and thank you for inviting me. Thank you for having me. It's wonderful to be part of this inaugural program, and I didn't know it was the first ever, but that explains why I couldn't find out what pediatric engineering means, but I look forward to...
We're going to do a video on that.
Good. I look forward to learning more about that. But, you know, in every day in patient care, we run into systems and informatics and data problems, and we need more people than just clinicians to solve these problems. As a physician, I'm not trained in data science. I'm not trained in process engineering. I'm not trained in computational biology or computer science or any of the things that we now need at the bedside to be better pediatricians. So I can't think of a more relevant and important course and field of study than pediatric engineering.
Well, we're excited that you're here. And one of the things that we're asking the distinguished speakers who are visiting is, why do you think that this is such a market that's growing, pediatric engineering and the device development and therapeutics necessary for peds as opposed to just the adult population?
I think our knowledge growth is increasing exponentially because of the integration of genomics into medicine, because of the integration of electronic resources, which creates more data than we've ever had before. All of our clinical data is now in an electronic health record rather than a paper chart. So we have at our fingertips enormous quantities of data. Interpreting that data and making sure that data is usable for the intended outcome is a huge task. And there are many companies out there that are trying to solve these problems, and they're not easy problems to solve. And so it is I think the next generation of growth in healthcare is going to involve the interpretation and analysis of data that we collect at the bedside to inform not just the care of that patient, but to inform the care of entire populations of patients. And that ultimately will interface with pharmaceutical development, with drug and device development, with both prophylactic, preventative, and treatment interventions that we make. We need data scientists, we need process engineers to help make all that possible.
And in terms of childhood cancers, you spend half your time in the clinic and you spend the other half developing advanced therapeutics. Mm-hmm. Where do you think the greatest unmet clinical needs will be in innovation in childhood cancers in the future?
Yeah, innovation in drug development in kids needs to start at the bedside to inform what we do at the bench. But it also needs, we need business models that make sense. Some of these drugs that we're developing cost, $500 million a year to administer. And to have a company develop a drug for a pediatric indication for a rare disease is really hard. So we need business and regulatory models that make that possible. The largest funder of drug development in the United States is the pharmaceutical industry. It's not the NIH, it's not the pediatricians.
Definitely not.
It's the pharmaceutical industry. So we need to make sure that pediatric drug development makes business sense for them, because we know it makes sense for the patients and families. We need to link those missions in a meaningful way.
Is there anything else that you feel the audience who watches this needs to know that could help you further advance your research?
We need smart engineers. Clinicians aren't going to solve these problems. We can identify the problems, but this is beyond our skill set, our training, our knowledge, and capacity to do. We really need well-trained engineers, computer scientists, data scientists to carry us through.
Well, how fortunate, because we're about to go hear your lecture. That's going to be to the future biomedical engineers that are sitting a room away.
Great. Thanks for having me.
Thank you so much.